ago. And we're still looking at that Omicron BA2 variant. This evening, though, I just wanted to, I saw a slide of or a photo in the New York Times, and I thought it was very interesting. It was difficult for me to get it all on one screen, but I wanted, I don't know, Sherry, I'm getting a message.
What message are you getting?
Only the host can share.
Oh, that's strange. I made you co-host. You should be able to share. Okay, I'll share it for you.
Okay. So it's the last one that I sent to you.
The last one? You did this
Yeah,
one?
the August 29th. Yeah.
Okay.
Because I
Can you
had
guys
date.
see the screen?
Sorry?
Are you seeing the screen?
No.
You're not seeing it. Okay.
It says sharing computer sound.
Okay. Okay, so let's go back. Okay, let's try it again.
Okay.
Okay.
All right. Is that the first slide? Or yeah. Oh, no, that's the last slide. Wait a minute. Why is it sharing it like this? I don't get it. It's
And
not
no,
giving you
yeah,
one slide at a time.
it's not.
All right. Okay. All right. Here we go. That's strange. But anyway, I thought this was a very interesting portrayal of the pandemic since the beginning in 2020. So as you can see, in January and February of 2020, there were no cases. And then in March, we had, at the beginning of March, we had the light yellow cases, and then it progressively went from light yellow to orange to very deep and dark purplish, dark red down into April. And then as we went into May and June, we went to the light color again. We never went back to no cases, but we went to the light color again. And then at the end of November, we started in with, actually sometime in August and progressing through November and December, we started in with Delta. And then you can see that wave where we went in January of 2021, we were in the deepest, darkest color purple possible. And then, we progressed again, started getting lighter again, and then all the way into December of 2022, when the Omicron, 2021, when the Omicron started rearing its head again. And then in January, you see, of 2022, we were into that really dark purple color again. And I just wanted to point out that even though we say cases are decreasing and declining, here we are in August of 2022, and we're not in the dark purple, but we're certainly not in that light yellow color that we were in, let's say in March of this year, and earlier in 2021, like in June and July of 2021. So it's kind of like we declined, but we never really hit that nadir of very low cases. And so, what I thought about was Yogi Berra, and he said it's not over till it's over. So although cases are declining and hospitalizations are declining, it's not over till it's over. We're nowhere near where we started at the beginning of the pandemic, and we're nowhere near where we were just in March of this year. So we're in August, and the cases are still high. And this is the city, this is New York City that's represented here. So we still have to continue with the measures. The other thing that I noted today was that a lot of people have gotten the initial vaccine series, but we're really lagging behind on the boosters. So coming this fall, we're promised a new booster that includes the Omicron, and I'm just praying that people would utilize the opportunity to take that new booster, because we're really behind on boosters. With the vaccination rate in the city, about 80% of all ages are vaccinated, but only about 33% have a booster. So that's a big gap. And then for 65 and up, ages 65 and up, 88% are fully vaccinated, but only about 56% with a booster. So we'll share the information as it comes along, and we're trusting that you'll spread the information that everyone should get the booster, especially if the new booster is coming out, to make that their endeavor to get the new booster. Okay, so that's where I'm going to end. And any questions?
Yes, I just
Yeah.
want to make sure. You said 80% in New York City are vaccinated and 33% do not have the booster. Is this correct, what you said?
No, only 33% have the booster.
I'm sorry, 33%?
So, yes,
Oh, half the booster.
yes.
I got you. Okay, thank you.
Yeah, so 70% roughly are not boosted. So 80% got the vaccine,
Gotcha.
but of that 80%, and they're eligible for a booster, only about 30% got the booster. So
Okay,
we're way behind on boosters.
good. 80% have the booster, 70%, 80% are vaccinated and 70% do not have the booster. Okay, that's an
Right.
easy number, 70, 80.
Yeah, okay.
Thank you.
Any other questions?
Yes, Dr. Crony.
Yes, hi Sabrina.
Hi, how are you?
Good.
Quick question. With the new booster, which was informed to us today at the train station, how long is this booster supposed to last? Is it going to be a little more longer than the other
Don't know.
boosters?
Don't
Don't
know.
know.
Don't
Okay.
know. Yeah. Don't know.
So is it the same, by the same, the same brand, like the ones the other
Yes, it's the Moderna and the Pfizer.
Moderna and the Pfizer?
I think we talked about it last week on the platform. It's the Moderna and the Pfizer. And so it's not approved yet, but it's like it's a booster that contains the original COVID and the Omicron and the variant that is prevalent now.
Okay, thank you.
Okay. Okay, if there are no further questions, Sherry?
Okay, we don't have any more questions. Okay, we're gonna call on the columna to come and give our presentation on monkeypox vaccine and the virus. So this is our new project coordinator for that new initiative. So over to you. Let me make you co-host. I did already. Okay. So you should be able to share. Let me see. Are you able to share your screen?
Let me see.
Or do you need me to share it for you?
Yes, yes, please.
Okay. I don't see what you see. You guys see my screen?
No,
Hold on 1 second. I don't know, Zoom is messing with me this evening. Okay. Now you see it, right? Can you let me-
yes,
Okay, good. Thank you.
Hello, everyone. My name is Lubna. I'm going to be discussing a little bit about monkeypox. So, slide, please. Next slide.
Can you still see the screen?
Can you
yes.
Yeah, I change it to slideshow. I just want to make sure you're still seeing it. I'm gonna load. How many of you want me to advance?
Yes. Can you? Next, please.
Okay.
Okay, so that's good. So what is monkeypox? This is a virus which is from a family of smallpox. It has a similar type of the symptoms of monkeypox are kind of similar, like smallpox symptoms. It was discovered in 1958 in the colonies of monkey. The first monkeypox human case was recorded in 1970. Before this year outbreak, monkeypox had been reported in people in several Central and Western African countries. Next slide, please. Okay. These are the case count in some of the states in America. So the data is as of August 22nd. This is the look at the numbers. 17,432 total confirmed cases in US, while worldwide cases are more than 31,000 in about 80 countries. It's look at the numbers. It's like 56% of the total cases worldwide. I jot down some of the states which has the higher number of cases. California and New York has the highest numbers. It's more than 3,000 cases. Florida has 1,700. There is some mistake in here. And Texas has about 1,400, Georgia 1,200, more than 1,200, and Illinois 1,100. Next slide, please. So monkeypox symptoms. About 95%, more than 95% of cases has rash. It can be anywhere on your body. It can be on your feet, chest, face, your private parts, hands. It has the rash has several stages, including scabs, and it can heal up. It can take about 2 to 4 weeks to heal. It looks like a blister or pimples. Some people have other symptoms too, like fever, chills, flu-like symptoms, swollen lymph nodes, tiredness, muscle aches, backache, headache, respiratory symptoms like sore throat, nasal congestion, cough. Sometimes people have flu-like symptoms before the rash. Some people get a rash first, followed by other symptoms. Next slide, please. How long it lasts? So it usually starts within 3 weeks of exposure to the virus. It, if you have like flu-like symptoms before the rash, it can take 1 to 4 days to develop a rash. Next slide, please. So these are some of the images. You can look how the rash looks like. It is pimple like. There is a indentation in the center. Redness around the pimple, and there is a scab. Now this is, I think it's the second and the third one is kind of healing. Next slide, please. When and where to get tested? If you think you have monkeypox, or you get in contact with someone who has monkeypox, call your provider, healthcare provider. If you don't have healthcare provider, you can call 311. Where to get it? It's you can go to local health department. Your healthcare provider can order that test. Next slide. Now, how it spreads? A person with monkeypox can spread it to others from time symptoms start until the rash has fully healed and a fresh layer of skin has formed. The illness typically lasts 2 to 4 weeks. How it spreads to anyone is from skin to skin, from direct contact with the rash, scabs, or body fluids, touching objects like fabrics, towels, bedding, clothing, you sharing utensils, eating utensils, face-to-face contact, kissing, sex, and bedding, towels, sex toys. Next slide, please. How you can prevent yourself and others? You avoid close skin-to-skin contact. Who has rash that looks like monkeypox? Do not touch the rash or the scab of a person with monkeypox. Do not kiss, cuddle, or have sex with someone with monkeypox. Avoid contact with objects like do not share eating utensils or cups. Do not handle or touch bedding, towels, or clothing of a person with monkeypox. Wash your hands often with soap and water, or use alcohol-based hand sanitizer, especially before eating or touching your face. Next. Monkeypox vaccine. About as of August 23rd, about 200 and more than 207,000 doses are administered. Jynneos is the only vaccine that is FDA approved for the prevention of monkeypox. People of the following conditions can now be vaccinated. People who are 18 years or older, gay, bisexual, men who sex with men, and transgender, gender non-conforming, or gender non-binary, have had multiple and anonymous sex partners in the last 14 days. Vaccination is free and available regardless of uh, I lost my page. 1 second.
You want me to go back to the previous slide?
Yes. Okay, so these are the, there is a link which you can go and check the eligibility criteria, what is if you are eligible and how to make appointment. This is the link. We can share it afterward. Can you go to the next slide, please?
You want me to go to the next slide?
Please.
I didn't hear you, sorry.
That's okay. So this is a flow chart. It's like a screening. It's a screening tool for the eligibility for vaccination. It's hard to see, but if you can, want me to go over with this or?
We don't need to go over this. I'll go to the previous slide and just point something out before you go on, if you don't mind. So,
Okay.
so just want to point out, vaccination is free. It's available to anyone regardless of immigration status. I guess I shouldn't say anyone. So the screening tool that will be used to determine the eligibility is what is on the next slide. That is like the flow chart. And this is also one of the things that we'll be supporting within the community. So if you have any family member or anyone that may think they may be eligible and they're not comfortable or they're not sure how to navigate the system, we have a phone number dedicated where they can text MPV vaccine. I'll put it in the chat, and then someone will reach out to them and be able to walk them through. We actually have a dedicated number of vaccine that is reserved for the clients, people in our community through Relum Fund, through the Department of Health for Relum Foundation. So, you know, if we don't schedule people, of course, they're going to roll it to the community, but we have it set up so that way people in our community that do meet the eligibility, you know, will not be left out because of lack of accessibility. So I just want to point that out. Go ahead.
Okay, that's.
I can't see the slides.
You can't see the slide?
No.
No, you have to be from your hand because I can see it. I have another device open and I can see the slide. So maybe it's the way you have your screen position. I'm not sure. But I can share this. We share the slide with you later, okay? Sorry about that. Go ahead, Dr. Lumina.
Okay, so what to do if you are sick? As I said before, call your healthcare provider. If you don't have healthcare provider, call 311. There is one drug which is approved called TPOXX, which is actually good for smallpox, but that monkeypox is a smallpox family, so it's good. We can treat the same with the same treatment, with the same drug as smallpox. However, the type of treatment of a person with monkeypox will depend on how sick someone gets. or whether they are likely to get severely ill. Most people with monkeypox recover fully within 2 to 4 weeks without the need for medical treatment. Some people, like those with weakened immune system or have genital or rectal rashes, may need treatment. Next slide. How you can take care of yourself if you have a rash. You can use bandages to cover the rash. Please don't scratch and don't touch your lesion, and it can spread to other parts of your body. Do not shave that area. Keep the lesion clean, dry, wash hands, eat healthy, get hydrated, get plenty of rest, wear well-fitting mask. Okay, next slide, please. Next slide. If okay, you can get over-the-counter medication like Benadryl, topical cream such as calamine lotion, which can help you which can help with itching. Soaking in warm bath, like using oatmeal. People can benefit from a sitz bath if they have a rash in their private area. Next slide, please. Advil and Motrin or Tylenol can help with fever, flu-like symptoms. If you have rash in your mouth, you can use mouthwashes. And remember to contact healthcare provider if pain becomes severe and unmanageable at home. Next slide, please. So these are some of the resources I put in the like the last one. Professor Sherry was telling you, you can text us MPV vaccine to 646-715-0203. We can help scheduling appointment for vaccine if you need any assistance. Otherwise, if you need to have some updates or text alerts, you can text monkeypox to 692-692. For Spanish, you can text monkeypox ESP. And for making an appointment, you can call 877-VAX for NYC.
Yeah, I'm sorry, I gave you the wrong number. I missed part of my other phone number with it. So it's 646-715-2009.
Okay.
Yeah, 2009. That's the right
Okay.
number. Thank you.
Thank you so much.
Is that the last slide? Okay, thank you so much. Okay, do we have any questions? I know you guys have questions. You're like thinking, Any questions? No questions. I know we did a presentation on monkeypox before. I think one of the main things, the highlights is the fact that we're able to help people schedule appointment. We have resources. If you have people in your community that you feel need flyer resources, digital, any kind of infographic information, so we can share that. If you have anyone, maybe any organization or any community member or group that needs a presentation, we can actually send someone from our team to go and do a presentation for them. So just know that the resources are there. So we're servicing the following zip code: 11691, 9293, 94, and 11432, 11433, and 11434. So those are the zip codes that we're responsible for. So that's Far Rockaway and the South Jamaica area. Okay, I don't know if Dr. Coney or Dr. Sunday want to add anything or anything from the field, from the staff on the field, anything you guys are noticing?
Great presentation, Lubna. Thank you for the time that you invested in putting this presentation together. So thank you very much.
Thank you.
Thank you for the presentation. We really enjoyed it. Thank you.
My pleasure. Thank you.
Okay, look at your colleagues are clapping, thumbs up, clapping, thumbs up from Reverend Gary, thumbs up from Jatir. Well done, very informative. Okay, if we don't have any, Mr. Walter has his physical thumbs up, not a virtual one. It took me a minute to see it. Okay, so if we have no questions, I guess we can call it a day. So just remember,
Excuse me, Professor. I have to ask Dr. Crum one thing. Is it so that you cannot take this booster if you had 2 other boosters from previous batch?
No, that's not true. You
Okay.
can take the next booster.
Even if you took 2 already?
Yes.
Okay, thank
Yes.
you.
As a matter of fact, there's just a piece of, I guess, miscellaneous information, but the human body can take roughly 10,000 vaccines and the immune system can handle it very well. And children get multiple vaccines at the same time. And they handle it very, very well. That's just, I don't know, you just get this information in your brain. It sticks
It was
there.
like that said it to the train station. They said, oh, they got a new booster and you can't take it if you had the other 2 because they won't allow it. So I said I was gonna wait till this afternoon to ask to confirm that one. So thank you so kindly.
Yeah, okay, no problem.
okay, thank you, everyone. Thank you for that answer, Dr. Crony. Thank you. Let's give our presenters a round of applause, Dr. Crony and Dr. Lunda. Thank you so much. And all of our audience, thank you for participating. We can't have a presentation without you. Thank you so much and have a good night, everyone. We're just a phone call away if you need anything. You know where to get us and how to get us. God bless. Have a good night.
Good night. God bless.
Good night.
Good
Good night,
night.
everybody.
Very good.
Night.